just opened our brand new expansion to our Little River office on 4303 Live Oak Drive here in Little River. So it has gone 26,000 new square feet, 2-story. Our old site is closed down for renovation and it will open up in December. So we now have room for 7 providers in the current site and 3 more coming on in December.
And Little River Medical, you are about providing medical services for anyone in our community, anyone in our society, no matter how prosperous or unprosperous you might be in financial terms. A lot of people have different definitions as to what that means, but the point is that if you need medical care, you ladies in your organization will deliver it.
That's correct. We are a medical home for the patients, so we are a community health center. We provide services for the uninsured and underinsured and those that have insurance, Medicare and Medicaid. So if a patient has financial troubles or any kind of thing, they can come and we will assess their financial status, and they can apply for our sliding fee scale, and at the lowest rate they pay $30 for their medical services. And then it's rate scale based on that income and number of members in that household.
Okay, so medical services are yours for the asking there. Is it necessary to make an appointment?
We prefer an appointment, but we do accept walk-ins as well. So we try to have same-day services at that site.
And if somebody really feels like they need a physician and need it now, maybe they're not ambulatory, but they just feel awful and think, my goodness, I better see a doctor. When can they do that with you?
We're open from 8 o'clock in the morning till 5:30 on Tuesday, Thursday, and Friday, and we're open to 7 o'clock in the evening on Mondays and Wednesdays. And we hope to expand those hours pretty soon.
I got to ask you this because we're waiting for this ruling may come today, it may come tomorrow, about what we've all come to call Obamacare, this health program where it would force American citizens, the first time ever there's been this kind of mandate just for being alive, just for being an American citizen, the government making you buy something just because you live. If this thing stays in place, or if this thing goes away, how does it affect organizations like yours?
Well, certainly if it goes into effect, there'll be thousands of people that are eligible now for insurance and become insured. So we stand ready, and that's why we're expanding and adding physicians to be able to provide that care when that heavy demand is there. Certainly a lot of our patients that are currently uninsured under this plan would become eligible now for health insurance, and also with the Medicaid expansion, they would be eligible for Medicaid. So a lot of people that aren't seeking care now just because they're sick, but they don't have the money, they stay at home and they get sicker, and then that's when they present to the emergency departments, and it's more costly care. So we're hoping that if more people do get insured, they'll come for preventive care. They'll come early enough so we can get those conditions under control, and will overall decrease the cost of care because they won't go to the hospital unnecessarily.
So if you're doing preventive work, maybe looking toward good health rather than being reactionary,
right,
it's going to cost you a whole lot less money.
Yes, it does. Well, by providing care with us, it has been shown to save patients hundreds of dollars per visit and thousands per year by not going to that emergency department. And so we are working to try to re-educate the patient, come to us first, get those well checks and visits, let us get your hypertension under control, your diabetes, to keep you out of that hospital or a life-threatening event from occurring.
Okay, do you have, let's take diabetes just as an example. You have classes, have information that help people live a better lifestyle and learn what to do about controlling the sugar?
Yes, the nurses and the doctors work to educate them on healthy lifestyle and behaviors. We have a certified diabetic educator that works with the clients on how to use the machines, how to control diabetes, what to watch for, and doing nutrition as well. With our expansion now, we have room now to have educational classes and big community events, and that's what we hope to do in the future for our clients.
Okay. And Lyn, of course, has been working on the fundraising side of things for quite some time, the foundation that provides the foundation of financial resources for Little River Medical. First, how are you doing?
Wonderful. How about you?
I have no serious complaints. I have a few, but Joe refuses to listen. So tell us about the latest home campaign here.
To support what Pam has just described, we continually are funding those individuals who cannot provide any type of payment for their services. And we're also looking at other ways to collaborate and to be a community partner. what we have most immediately on the horizon is a campaign on the new site that will feature paved bricks in honor of or in memory of a loved one, a friend, a co-worker, whatever you choose. Very reasonably placed. The brick costs $100, and there is a small memento brick for $25.
Okay, and if you buy a brick, you have whatever inscription within limits on there that you want to put. If you wanted to honor someone who's been in your past, or honor something present. I've known people even honored their pets before, but the
That's
point
correct.
is,
we have that now.
Yeah, a lot of pets very popular. I think my dog Oscar would be a lot more popular than me in my family. But the point is that when people do that, they're helping provide these necessary medical services.
Absolutely, and as you share that, as Pam mentioned, we've had some pet remembrances, if you want to call it that. I personally purchased one for my mother and father who are deceased, and they do not live in the area, but it's nice to be able to walk out and see their names in a very prominent location. And so that's what we're hoping to have a garden effect with these paved bricks, a walkway that individuals will be able to see or visit as they wish.
Now, well, $100 for a single brick.
Correct.
What if you want to buy a bunch of them?
We would certainly welcome that. There might be a way to look at that as far as a discount for a large purchase, but we don't want anything to deter someone from taking that step. We're allowing our employees to do payroll deductions for them so that they can make that decision, and we're hoping for the holidays and for other events that they'll take advantage of this to do that special gift. If you have a coworker and you don't know what to give them, do this. That little memento, the $25 would be very appropriate.
Now, Lyn brought me a list this morning that has a number of different areas at Little River Medical that are involved here with the health care and the things that make up Little River Medical. And are these naming opportunities? If you wanted to name, say, a staff lounge or a training room, a nursing section, exam rooms, physician's office is named in that individual or entity's honor that you're paying the money for.
That's correct.
Okay.
Those items, Bill, are combined with the construction that's in process and it has been completed. And we know individuals who might want to make that type of gift for a physician exam room or for a lab or for an x-ray area, or at least a portion of it. Pledges can be taken and they can be over a 3-year period of time, whatever's convenient.
All right, and folks, we do want to point out that the organization Little River Medical Center Incorporated is a 501c. That's an official chartered non-profit corporation, so you are dealing with what for you would be a tax-deductible situation, which always can help when it comes to Uncle Sam's tax time.
Absolutely.
All right, anything else, ladies, you want people to know about Little River Medical that they might not be aware of?
Well, we want them to make sure that they know where we're located and that we're open for business. The new site is open. We're accepting new patients. And certainly if they know someone that's in need and doesn't have a primary care home or a medical doctor, to please refer them to us. We have sites all over the county, but our biggest site right now is in Little River. We are planning an expansion for our Myrtle Beach office, and we're going to be opening a South End office on Holmestown Road and hope to have that open by November 1st.
Okay, got some ambitious plans that continue to grow as this coastal Carolina area continues to grow and mushroom. And Pam and Lyn, I thank you so much for sharing with us and being with us today on Little River Chamber Chat.
Thank you.
And help me keep Jo in line here so she doesn't get in trouble before we leave the studio today. Jo, any